I'm Dr. Sugandha Gupta, consultant psychiatrist, Delhi Mind Clinic, Karol Park. As a practicing psychiatrist, I've always felt that until 2 years back, we were struggling a lot to generate emphasis and awareness about mental health needs. However, the way the pandemic has hit us, all of us, in the last 2 years, it has brought forth and emphasized the presence of mental illnesses across all ages, across all cultures, across all places, and has emphasized the need for one to take care of their mental health along with their physical well-being. In the last 2 years, one of the most common difficulties that we saw patients come up to with was anxiety, and that is what we are going to talk about today. So what is anxiety? Anxiety in the simplest of terms means a sense of apprehension, a fear of unknown, and sense of unease. However, anxiety is not always bad. It is actually a conditioned response of our neural system which is meant to protect us and help us. How? Well, from the prehistoric times, the cavemen, it was anxiety which kept them alert and could protect themselves from the wild animals running around. It is anxiety which keeps a student on its toes and helps him prepare better for his exams. However, it is only when the anxiety becomes too overwhelming that it becomes a disorder. But then how does one know if their anxiety is normal or not, whether it is a disorder or not? In the simplest of words, again, we look for 3 Ds. Distress, to self or to others. When a person starts to think, why am I doing this? Why am I thinking so much? Why am I worrying so much? Dysfunction. If a person is unable to perform or participate in the activities that are seemingly usual for that age and that place, for example, not being able to enter a lift because it's crowded, having to let go of a metro coach because it is crowded, not being able to write in an exam because you're shivering or trembling or because you've gone all blank because of anxiety, that is dysfunction. And then deviation from the usual self. When a person himself or his family members feel that it is a change, I never worried so much, I never really did these things so much, why am I doing this? All these factors help one decide whether their anxiety is normal or not and whether they require any help or not. So anxiety manifests differently in different people. There are 3 basic types. One is cognitive anxiety. These are the people who worry a lot. If this happens, then what will happen? What if I get late? What if this happens? What if that did not happen? Why did he say that? Why did he do this? A continuous sense of worrying, unnecessary, irrational thinking which interferes with their productivity. Autonomic anxiety. Racing of the heart, palpitations, shivering, breathlessness, chest pain, giddiness, nausea, vomiting, all these are symptoms of autonomic anxiety. And then there is somatic anxiety, people who are tense, body aches, shoulder pains, heaviness of the head, tenseness all over the body. These are the symptoms of somatic anxiety. Now, every person is different. Their anxiety may manifest differently. All these symptoms in different combinations can be there. And based on this, we have different anxiety disorders, panic disorders, phobias, generalized anxiety disorders, and so on. And we'll talk about them a little bit more in detail a little further. However, the good thing is that all anxiety disorders are treatable. Whether it is with the help of medication or psychotherapy, counseling, cognitive behavior therapy is something that can be told with after a formal assessment. Howsoever, most of the patients do benefit and they recover well from their anxiety. Contrary to the popular belief that if medication for anxiety is started once, it just carries on, is also not fine. That these are medications that just make you sleep are also not fine. Most of the medications are given for short periods of time, which is based upon specific research guidelines which are practiced nationally and internationally. Hence, one should not delay seeking help. I hope with this information you can better identify anxiety in you and your loved ones and seek help at the right time. Milder symptoms can also recover well with specific behavioral techniques like cognitive behavior therapy, exposure response prevention, and so on. Help is available. Please seek help at the right time before it becomes a little too overwhelming to function. Wish you all the best and the best of health. Take care. Bye.